Welcome to the new patient immunotherapy class for patients and families. We will cover important information to prepare you and your family for receiving immunotherapy. In this class, you will learn about what to expect during immunotherapy, how to manage possible side effects, and how to look after yourself while receiving immunotherapy. Please keep a notepad with you to write down questions as you go along. We will review these with you on your first visit to the treatment room. This class covers general information. Specific information about your treatment protocol will be given to you by your cancer care team and by the treatment room nurse and pharmacist when you have your first treatment. Over the next 60 minutes, we will explain who your cancer care team is and who to call, talk about what immunotherapy is and how it is used to treat cancer, explain the common side effects of immunotherapy and how to manage them, share some resources to help you and your family cope during treatment, and lastly, we will talk about what to expect on your typical visit to the cancer center for treatment. There are many people involved in your care at the cancer center. The team works together to give you and your family the best care and support during your cancer journey. You and your family are the most important members of the care team. You know best about your health, your values, and your needs. The rest of the team will work with you to provide care that focuses on your needs and goals. The healthcare professionals involved in your care will depend on your individual situation. Beyond our doors, you still need to keep in close contact with your family doctor. They will continue to provide care and order you routine medications, as well as manage any pain medications you may need. You may need to make an appointment with them at some point along your journey. The Southeast Lynn community nurses will also provide care as needed while you are at home. Other team members you may encounter include pharmacists, our social worker, and our drug navigator. If at any time, if your problem is a medical emergency, go directly to your nearest emergency department or call 911. I'd like to refer you to the After Hours Symptom Management handout at the front of your binder. This includes the orange immune checkpoint inhibitor wallet card. On your first treatment, you will be provided with an After Hours patient information sheet. This includes your diagnosis, oncologist, current protocol, and up-to-date medication list. It is essential you have this information with you anytime you call one of our care lines or present to the emergency department. This will help the nurse provide the most appropriate support. During our clinic's working hours, which are shown on this slide, you can contact an oncology nurse at our clinic for any questions or concerns related to symptoms or side effects of your treatment. An after-hours care service called CarePath provides telephone service from 4 p.m. until 8:30 a.m. CarePath is supported by oncology certified nurses that can answer your questions related to symptoms or side effects. They will notify us by fax if you have contacted them, and we will follow up with you as soon as possible if needed. While on treatment, you have 24-hour access to an oncology certified nurse by phone. Also available to you is your Southeast Lynn community nurse, also known as your home care nurse. Your immunotherapy card includes some key information about possible side effects and what you should do. If you go to the emergency room, be sure to tell them that you are on immunotherapy and bring your after-hours symptom management patient information sheet with you. Keep this card with you at all times and for 6 months after you finish treatment. We are going to focus quite a bit on the possible physical side effects of treatment, but we feel it is important to talk a little bit about taking care of your emotional health at the beginning of this session. We know that this can be an overwhelming time for you, especially if you are dealing with a new diagnosis or starting a new form of treatment. Feelings of anxiety and sadness are normal for patients and families coping with cancer. We encourage you to share how you are feeling with loved ones and with your cancer care team. It helps to talk, and it also helps others in your life understand how they can help you. If your feelings continue and start to interfere with your ability to do regular activities, you should seek extra support. Please let your doctor and nurse know how you are doing. On the screen, we have listed some things you can do to help your emotional well-being. Find support. It can make you feel better and less alone. Focus on the things that make you feel better. Think about the positive parts of your life and things that you can control. Take care of your body. Make lists of calming, enjoyable, and useful activities. Try relaxation activities. And get counseling to help you cope. Immunotherapy is a type of cancer treatment that uses your body's own immune system to help fight cancer, just like it fights infections like the flu. It is similar to chemotherapy in that both classes of drug therapies destroy cancer cells, but a big difference is that while chemotherapy targets the tumors directly, immunotherapy targets the interaction between the immune system and cancer cells. It empowers your own body to destroy tumors. Immunotherapy treatments helps your body know that the cancer is something it should try to get rid of. When your immune system knows that the cancer is there, it starts to work harder to destroy your cancer cells. Immunotherapy works better for some types of cancer than for others, and your care provider will help you to decide if immunotherapy is appropriate for your diagnosis. In order to understand how immunotherapy works, it is helpful to review how our immune system works and how the immune system is used to fight cancer. Your immune system is a network of cells, tissues, and organs that work together to recognize and destroy foreign invaders such as bacteria, viruses, and abnormal or unhealthy cells in your body. Usually, we think of the immune system as our defense against infection, but we know that it can also work to fight against other diseases like cancer. Think of the immune system as an army going into combat. It has many different kinds of soldiers, shown here in the diagram, that work together to protect your body. The most important function of the immune system is to know the difference between self and non-self. Self means your own healthy body tissue. Non-self means any abnormal cell or foreign invader, such as bacteria or viruses. Normally, your immune system will not attack anything it identifies as a healthy part of itself. Please read the content on the following slide. There are several types of immunotherapy now being used to treat cancer. They are called monoclonal antibodies, therapeutic vaccines, cytokines, and checkpoint inhibitors or blockade therapy. In this class, we are going to focus on the class of immunotherapy called immune checkpoint inhibitors. There are many large words on this screen that may be difficult to remember. You do not have to memorize this. The important thing to remember is that if you are seen by a doctor in the emergency room or by your family doctor, you should tell them that you are getting an immune checkpoint inhibitor or immunotherapy for your cancer treatment. Now we will focus on the specific drug therapies you are taking called checkpoint inhibitors. These drug therapies work by taking the brakes off the immune system. We talked before about how your immune system will not attack anything that it identifies as a healthy part of itself, and because cancer cells grow from our own tissue, it can look like normal cells, so your immune system does not recognize the cancer as something it needs to attack. The way that your immune system naturally stops itself from attacking the cancer is essentially by using a checkpoint, which can be thought of like a car brake. These drug therapies basically take the brakes off an important soldier in the immune system, a type of white blood cell called the T cell lymphocyte. We know that T cells can help recognize and attack cancer cells. The drug therapy removes one of the cancer defense mechanisms it uses to invade, escape, or hide from destruction in the body. Checkpoint inhibitors block the ability of cancer cells to use these checkpoints to escape from the immune system. The checkpoint inhibitor can then reactivate T cells, which can fight the tumor. Every time the immune system is stimulated, there are checkpoints, which are complex signals that stop immune cells from attacking and destroying normal tissue while they continue to attack abnormal cells. Please see the video on the following slide for a little bit more information on checkpoint inhibitors. The side effects of immunotherapy are different from the main side effects of chemotherapy. With immunotherapy, side effects come from an overactive immune system, and the immune system starts to attack some normal organs in the body. Since your immune system takes care of your whole body, side effects can happen in many of your organ systems, some of which may be serious. These side effects are typically short-lived, but occasionally can be severe or fatal. Now that you have a better understanding of how checkpoint inhibitors work in your body, it helps you understand why some side effects may occur with immunotherapy. Common side effects include skin rash, diarrhea, changes with your liver, issues with your pituitary gland, thyroid, or adrenal glands, fatigue, and even changes with your mood. Everyone is different, and side effects are possible during or after treatment. This is why we want you to keep your immunotherapy wallet card with you for 6 months after your treatment ends. Side effects are typically short-lived, but occasionally they can be severe or fatal. Your awareness, close monitoring, and good communication with us is essential. Please never hesitate to call the clinic or the after-hours symptom management phone line. Let's look at the ABCs of immunotherapy. First is awareness. Reference the drug therapy information sheet provided by your team. You will know more about this drug therapy than people in your family doctor's office and the emergency department. They should be encouraged to call us with questions if you are being seen. Be alert. Keep track of your symptoms and update your care team every time you meet. Use your diaries as a way to remember information. Communication. For the first while during treatment, a nurse from our clinic will make weekly phone calls to check in on you and ask some questions about specific side effects. If you have any negative changes to how you're feeling, you should call us and report it. It's better to let us know earlier than later. Low-grade side effects are usually reversible, but you need to inform us of any changes that may be happening. Side effects can happen at any time throughout your treatment, up until 6 months following your treatment. Some people can have infusion-related reactions during the treatment. You will be monitored closely during the infusion, and it's important to let your nurse know how you are feeling. If needed, we can give you medication before your treatment to help with this. A few important things to remember about side effects are: treatment may be supportive or may require steroid treatment. You may need to be admitted to hospital or see a specialist to manage the side effects. Some, more severe, may require treatment delay or discontinuation. And consider investing in a medical alert bracelet so other healthcare team members know you're receiving immunotherapy. The care provided for side effects can be different than if you were receiving chemotherapy. One of the most common side effects is a rash or dry, itchy skin. It is often one of the earliest side effects experienced, and most rashes can be managed with medication without discontinuing your immunotherapy treatment. Careful attention to the earliest symptoms can stop diarrhea from becoming more severe. If you do have bowel changes that concern your oncologist, they will investigate to confirm the cause. Depending on how severe your changes are, you may be monitored for ongoing changes or treatment with corticosteroids. There may be a delay in treatment, or your treatment may be stopped altogether. If you develop diarrhea, do not use anti-diarrhea medications without direction from your oncologist. Try to drink at least 6 to 8 cups of liquid each day. Avoid food or drink containing artificial sweetener, and avoid coffee and alcohol. Plan to eat multiple small meals and snacks throughout the day instead of 2 to 3 larger meals. Constipation happens when you're not having bowel movements as often as you usually do. When you're constipated, your stool is hard and dry, and having a bowel movement can be painful and difficult. Like nausea, it is important to prevent or reduce constipation before it gets worse. Constipation can be managed with medications. Your doctor may suggest stool softeners and laxatives that you can buy without a prescription, but be sure to talk to your oncologist before taking anything. If you find you are constipated, try adding more fiber in your diet from foods such as whole grains, fruit and vegetables, dried fruit, and prunes. Drink plenty of liquids during the day and be more active as you are able. Changes in your breathing are uncommon but can be serious. Call your cancer care team right away or go to your nearest emergency department if you are having trouble breathing, wheezing, coughing, or experiencing chest pain. Be sure to bring your immunotherapy card and patient information sheet with you. Checkpoint inhibitors can cause inflammation of the liver. You may not have had any symptoms of this, but your blood work could show abnormal liver lab results. Your doctor will monitor your liver regularly with blood tests. Depending on the severity of the inflammation in your liver, your oncologist may just monitor you or they may treat you with corticosteroids. If your lab results show a severe impact on your liver, they may delay or discontinue your treatment. Immunotherapy can cause nonspecific symptoms such as nausea, headache, fatigue, and vision changes. Make sure you let your cancer care team know if you experience any of these symptoms. If your medical oncologist has concerns, treatment will include seeing a specialist, regularly monitoring, or for acute or severe cases, you may receive treatment with corticosteroids. Some people experience hyperglycemia, also known as high blood sugar, and your cancer care team will be monitoring your blood work for this. Treatment may include insulin. Fatigue is amongst the most common side effects seen. Usually fatigue is generally mild and severe fatigue occurs rarely. Some tips on managing fatigue will include pacing yourself. When you are fatigued, you have less energy for daily activities. Use your energy wisely in order to be able to do the things that are most important to you. Plan to complete necessary tasks first thing in the morning when you have the most energy. Exercise. Choose a light activity that you enjoy like walking, yoga, or a stationary bike. Eat healthy foods with lots of variety to have more energy. Be patient and listen to your body. Sometimes, even after trying all these tips, you may still feel fatigued. Be gentle and kind to yourself during this difficult time. It's okay to rest. Please read the following slide on important points about all side effects. Nutrition is an important part of your cancer treatment. Eating well can help you to maintain your body weight, improve your energy and strength, decrease the risk of infection, and assist your body with healing and recovery from cancer treatments. Eating well can be difficult depending on the type of cancer you have and the treatments that you receive. Registered dietitians are available to help you meet your nutritional needs before, during, and after treatment. A registered dietitian can provide a nutritional assessment and help you set realistic goals. They can also help you to manage symptoms or side effects related to cancer and treatments, such as unintentional weight loss, loss of appetite, trouble swallowing, taste changes, sore or dry mouth, nausea, vomiting, diarrhea, or constipation. When you check your temperature, if it is 38.3 degrees Celsius or higher, go directly to your nearest emergency department with your immunotherapy card and patient information sheet. If your temperature is 38 degrees Celsius, check it every 15 minutes for 1 hour, and if it remains 38 degrees Celsius or greater, go directly to your nearest emergency department with your immunotherapy card and patient information sheet. Do not wait and see. Regardless of how you are feeling, you must present to the emergency department if you have met the criteria listed on the slide with your immunotherapy card and patient information sheet. You will need to be assessed because this might be a medical emergency. If you experience cough, diarrhea, rash, or abdominal pain, even if you feel quite well, it is important that you contact the cancer clinic or after-hours symptom management line for guidance, or go to your closest emergency department. Here are some things to avoid while on immunotherapy. No invasive procedures unless approved by your oncologist. This includes cataracts, scopes, surgery, generally no poking or breaking the skin of any kind. No dental work, none, not even cleaning. Your oncologist must approve this even if it's urgent dental work. Always maintain good hand hygiene. Hand hygiene is your first defense against viruses and bacteria. protect yourself. Please read the slide on safe handling of your bodily fluids. Some types of immunotherapy can cause sexual changes. These changes are different for women and men. There's also a lot going on emotionally and physically during treatments that can affect your desire for sexual activity. Problems both men and women experience during treatment: feeling too tired to have sex or not feeling interested in having sex, feeling too worried, stressed, or depressed to have sex. Here are a few things to remember during immunotherapy treatment. You can talk to members of your cancer care team about sexual changes or side effects. It may be an uncomfortable subject to bring up, but sexuality is a big part of quality of life for many people, and we can help you. Be open and honest with your spouse or partner. Talk about your feelings and concerns. If you are having sex less often, try activities that make you feel close to each other. If you or your partner are able to become pregnant, you must use birth control. Talk with your nurse or doctor about birth controls and ways to keep from getting pregnant. Some immunotherapy can cause fertility changes in both men and women. Infertility is the inability for women to become pregnant or for men to get a woman pregnant. Whether or not your treatment will affect your ability to have a child depends on which drug therapy you are taking, your age, and your general health. Not all drug therapies lead to permanent infertility. If you plan to have children in the future or think you might want to, tell your cancer care team as soon as possible. Talk to your doctor before starting treatment so you can discuss any fertility options available. There are brochures you can pick up at our clinic waiting room if you would like more information about fertility changes and cancer. In this section, we will cover what you can expect on the days you receive treatment, including the types of appointments you will have and what to bring with you to your appointments. During your treatment, you will generally have two kinds of appointments. One where you will see a nurse and doctor, and the other where you will only see a nurse to receive your treatment. How often you have these visits depends on your specific immunotherapy protocol. We will go through what to expect on these days. Step 1 is registering at the registration desk in the oncology clinic waiting room. Each cycle includes a clinic visit, a treatment visit, and recovery days after the treatment days. Generally, it is 14 to 21 days between treatments. Length of infusion time on treatment days depends on the type of drugs you receive. Some of the treatments we provide here all have different schedules and can be every 2 to 3 weeks, with treatments lasting from 30 to 90 minutes. Your cancer care team will discuss your specific protocol. A typical clinic visit will start with getting your blood work done. Your blood work allows the cancer care team to check your blood counts and make sure your body is healthy enough to receive treatment. You will then have a checkup with your doctor and nurse in the clinic. They will assess you to ensure you are fit to start or continue treatment. Remember, this is your time to tell your doctor or nurse how you have been doing and explain any side effects that you have had. Some people find it useful to write notes or questions down on a notepad and bring it with them to their appointment so they cover all their questions and concerns. Bring up any questions about prescriptions at this visit. You will be told at your clinic visit if your treatment needs to be delayed for any reason, like if your blood counts are too low. The Your Symptoms Matter questionnaire will be given to you when you register at the reception desk. When you fill out the questionnaire, the scale relates to how you are feeling that day. Please do not forget to tell us about any difficulties or side effects or symptom changes you've had since your last visit. Once your treatment has been prepared by the pharmacy, a nurse will start giving you drugs through an IV. Before that, the nurse may give you pre-medications if your medical oncologist has decided that you need them. While you get treatment, the nurse will talk about specific side effects that are more likely to occur with your treatment. The nurse will check on you regularly and take your vital signs, which include your blood pressure, heart rate, temperature, and oxygen levels. Most people do not feel pain or anything unusual while they are getting their cancer drugs. If you do, tell your nurse right away. Pick up your next appointment at the treatment clinic reception desk before you leave. When you come for your first treatment, you will likely already have your blood work drawn. You can expect a phone call from our registration clerk 3 days prior to your appointment to confirm your treatment time. If you are unsure of the duration of your treatment, you can ask the clerk how long you expect to be at the clinic. On the day of your first treatment, you will have the opportunity to meet with a cancer center pharmacist to discuss your medications. Ensure you eat a light meal prior to your treatments. Always bring your health card to every visit. If you have not already provided it, you may need to bring your private insurance information with you. Bring money to pay for prescriptions on your way home from the cancer center, or things like parking and coffee. Bring food and snacks. Drinks will be offered free of charge. Bring anything that helps you stay occupied. There's free wireless internet in the clinic. You can use your cell phone in the treatment area. We encourage you to bring a friend or family member with you during the treatment. For safety reasons, pregnant women and children under the age of 18 are not permitted in the treatment area. If you are looking for more information about cancer and its treatments and living with cancer, please look at the patient handout wall in the clinic waiting room. Some other resources have been provided on this slide. If getting into the hospital is concerning you, the Canadian Cancer Society can provide you with driving services for getting to medical appointments. Call the Canadian Cancer Society for more information. Some key takeaways. 1. Know when to present to the emergency department. Refer to your immunotherapy card. 2. Know that you have access to an oncology certified nurse through the oncology clinic and the after-hours symptom management phone line. Never hesitate to call. Thank you for taking the time to review our teaching presentation. When you come to the clinic for your first treatment, please be sure to bring any other questions you might have so we can review them with your nurse. Thank you.